Hello, everyone. I am here with the wonderful Brittany Angeles. She is a dental hygienist that I had the opportunity to train not too long ago. Hello, Brittany. Thanks for being here.
Hi, Tosha. It's good to be here. Thanks for having me.
Absolutely. Well, tell us about yourself. Where do you practice? How long have you been a dental hygienist? What type of practice do you work in?
So I've been a hygienist for about 7 years, and I have spent 6 of those years in a small one-doc practice private in West Nashville, Tennessee.
Awesome. Awesome. So before you found this approach that I teach, what was a day-to-day kind of like? Like, were there any frustrations that you had on a regular basis? What was kind of your everyday, how did it look?
So we're very high volume, and I was the only hygienist for a long time, probably close to 2 years. And then we had someone for about a year and a half, and then I went another probably 6 months, 6 to 8 months by myself again. It's a lot of just get through it, go through the motions. It's very easy to get desensitized that way. So a lot of times I was just, okay, you're clean. I need to see my next patient. It's not intentional, but yeah, I think everyone can relate to that when you just have a lot of patients that need to be seen. So I think I was definitely in a little hygiene rut for sure.
Yeah, I think any hygienist that's done it for any length of time, it can get overwhelming and redundant, but not redundant. And yeah, all the things. So when you first were introduced to this new way of practicing, we met at a conference that I was teaching. What was it about that conference that you were like, whoa, there's a different way to do this? Like, what is this microscope business? What did you think when you saw all that?
So my doctor had actually been kind of getting word of the microscope and watching a couple of videos here and there prior to that. And then we got the flyer for the conference in the mail at the office. And doctor was just kind of like, hey, look, they have a microscope course here. I was like, yeah, you've been kind of eyeing that for a minute. Maybe it's a sign we should go. So we went, and coincidentally, he was actually the one to introduce you
Yeah.
there. So that also felt kind of right. And honestly, as soon as the presentation started, I was immediately locked in because I was already interested from the inkling that he had kind of already had. So I was just taking my notes, looking, listening. A lot of what you said resonated with me because I had kind of secretly felt like I was the only hygienist doing bloody prophies and being desensitized. And you started saying all the things that I had been thinking. I'm like, okay, I guess it's not me.
Not alone.
Yeah. And it was a lot of things that I needed to hear. And I was like, okay, maybe there's a way out of this rut. And I had always believed we would find the right hygienist, the right fit for the office, but the show must go on in the meantime. So as soon as I started seeing all these slides and all of the information you were sharing, I was just kind of like hunched over, writing down, like, all right, I think this is going to be exactly what we need. It's going to be the game changer for sure.
Awesome. Awesome. Yeah. I mean, I definitely was, all the years that I sat behind patients and especially in the early days, I felt like I was doing the best job that I could do. I knew that my patients were doing a great job as well. So it wasn't like it was a neglect on either side. It was just the blood was everywhere. And I mean, not everyone was bleeding heavily, but I mean, the majority of patients did have bleeding to some degree. And for me, and I'm sure like you as well, it's when they're very clean, they come in regularly. It's like, what else can we do here? Because there's nothing more to clean off. And we've done all the things, but we know now that science has progressed and our protocols need to as well. And yeah, it can make such a difference. So once you finally started to take slides on your own patients, you got through the protocols, you learned how to treat people in a more antimicrobial, so not treating bleeding gums like a debris problem, but like the infection problem that it is. And your patient started seeing their slides. What was that like?
It was what you said. A lot of them had very visceral reactions. I actually have some quotes here.
Great. Oh, tell me.
This really does something to a person. This is burned into my brain. I'm traumatized, but I needed to see this. Yeah, I'm going to go buy a water pick right after I leave here. That's gross. Get it out of there. Do whatever you need to do. And my personal favorite, I have no one to blame but myself.
Oh, wow. That might be my personal favorite as well, Brittany. I absolutely love that.
Love the accountability.
Yes, the accountability piece. Exactly. It's like, okay, we're going to have teamwork here. I'm going to do my part as a hygienist. You're going to do your part as a patient. And together, we're going to get rid of this infection. I love that. So with the conversations that you've had with patients, it sounds like for the most part, they finally understand their infection. I mean, I don't know about you, but for me, when I would explain people the bleeding that I saw and the changes in the inflammation before I had a microscope, I was trying to articulate what they couldn't feel or see. And so I was poking around in there. And so it was kind of natural for them to think, well, Tosha, you're poking around in there. Of course you're seeing inflammation and bleeding. Stop stabbing me. Did you feel like it kind of opened, like, or removed a barrier, I should say?
Absolutely. Because honestly, who has time in their day when you have a schedule full of 10 patients to pull up x-rays and explain to them what an x-ray is supposed to look like and why their x-ray does not look like what it's supposed to look like, and then turn around and explain what probing is, and then explain to them why their probing depths are not what probing depths should be. And I love educating, but you need the time and space to do that, and it's just not realistic. And all of that is eliminated as soon as you see the slide. It's like, see that? It doesn't take a microbiologist to figure out that that's gross and it's in your mouth, and you just saw me take it out of your mouth. There's no room for argument here. Here's the chart. Let me go get your treatment plan. I'll be right back. Any questions?
Totally. Totally. Do you feel like your patients have been more on board with their home care and just the overall understanding that, oh, I literally just came in contact with some unhealthy bacteria. I now have an infection. It's not because I have a dirty mouth problem. Do you feel like your patients just like get it like pretty quickly within how many minutes do you think it takes from showing them their slide to them being like, oh my gosh, that's in my mouth. I have nobody to blame but myself. That's the one said, which honestly isn't always true. I mean, sometimes we just come in
Yeah.
contact when we get sick, but
I mean, maybe 2 minutes. I mean, it's very quick.
yeah.
And I always make a point to say, this isn't because you didn't go to the dentist, you didn't brush or floss, you didn't take care of your teeth. It might contribute some to it, but it's not the only reason. It's the same as if you touch a dirty doorknob or a gas pump and then touch your face and get sick. It's just that your gums got sick instead of your body. And you can see them, like the gears turning and their eyes kind of darting around and their face fall. Like, oh my God, I come here every 6 months. What have I done? So I try to catch it. Like, don't
Yeah.
blame yourself too much. Don't beat yourself up too much. And I think that helps. I actually have had some patients be like, thanks for saying that, because that's definitely what I was doing. I'm like, before you get in your own head too much, let's just talk about what we need to do to fix it. It's already there. So there's no point in beating yourself up.
Yeah. That's great. That's great advice. Any hygienists listening, that's exactly what our patients love to hear, because if any hygienist out there is like me, I used to do a lot of teaching, but I was telling, and I think I was doing a little bit too much lecturing and making them feel like it was their fault. Oh, you didn't floss well enough. Oh, you weren't using that water pick. Oh, you did this, that, and the other. And I mean, that's just not the whole story anymore. So what was it like working with me? Was it easy, hard, brutal, fun?
Not at all. It was a lot of fun. It just made sense. Everything clicked in a way that it hadn't before. And it's not like I didn't learn periodontics in dental hygiene school. I mean, we only had 18 million semesters of it. But I don't know if I just wasn't mentally present or if it just wasn't presented to me in the way that I learned. But whenever you started explaining everything, all of it made a lot more sense than it did before. So maybe I'm like the patients. Maybe I need to see the microscope slide too for it to really resonate. But also, even in the 7 years since I've graduated, things have changed because there were things that you said that they didn't teach us, which is normal. And that's why we do CEs.
Yep, that's exactly why. Science progresses so quickly. I know for sure that I explain periodontal disease and bleeding gums not even close to how I did when I graduated or how I was taught in school. Because what I realized was that my patients didn't want to learn my language. I mean, they were there to get their teeth cleaned, and it wasn't a disrespect thing. It was just they didn't get it, and I wasn't using words that made it sound like that big of a deal. And so there was a major disconnect there. So I know for me too, Brittany, I needed to see the microscope slide, because when I personally started seeing those slides, I was shocked because many of my patients looked really good and their microscope looked really bad. And I was able to intervene that early and just wipe out the infection. It was so much easier than people that come in that have had an infection for a decent amount of time. Now they have bone loss in their jaw. Now they have those bacteria all up in their bloodstream. And now I'm trying to play catch up. So it's like rescue dentistry versus proactive, reactive versus proactive. I mean, I'd always rather be on the proactive side for sure.
Yeah, it makes the actual SRPs so much easier. I used to I wouldn't say dread, but I was always apprehensive the day that I had an SRP appointment. And I don't really know why. And it always went well. Nothing bad ever happened. And after every time I would be like, I don't know why I was stressed out and anxious about it. But now I'm always excited to do them. Like, I
Yeah.
have SRP today. I can't wait. And I think it's just because your program makes it so structural that I just have to follow the guide and I don't feel like I'm just out there. And I also think it's because I know that the patient knows why they're getting it because they
Yeah.
saw it. And so there's like trust and rapport between us. And I think it's just, I do it a lot more. So I feel more competent, more skilled, and confident in it. So it's really changed my whole perspective as a practitioner. And I can feel like I know that my abilities have just skyrocketed. So I have you to thank for that.
My pleasure. My pleasure. I mean, I just enjoyed practicing so much more after I had a microscope as well. I mean, at
Uh-huh.
first I was like, oh my gosh, it's going to be one more thing to do. I don't have time to do one more thing. But then it gave me so much time. Like you were saying, 2 minutes, and the patient's like, oh my gosh, get that out of my mouth versus let me show you your x-rays, the bone loss on your x-rays. Let me show you your pocket depths. Let me now explain and try to articulate all that stuff for you versus just you came in contact with some unhealthy bacteria. There's a change, just treat that infection and get you healthy again. It's just so much more concise and makes a lot more sense for us as dental professionals and for the patient as well. So what would you say to anybody that is considering a program like this?
Just do it. Just do it. It's intimidating. It's so scary because you're going to have a million questions run through your head. Like, what? Like, I don't have time for this. How am I going to do this when I don't even have time to like drink water and go to the bathroom and perichart and take x-rays? And how am I going to explain to this patient that I've been seeing for 4 years and doing a prophion every time that they suddenly have periodontal disease and they're going to not trust me? But Tosha has an answer for all of those questions and also ones that she didn't think of. And the best answer to the question of why didn't you tell me sooner is that we're always learning new things and we want to share that new knowledge with you because it's true,
It's totally true.
but
If
it's
I
the way you present it, you know?
presentation is everything. I mean, if somebody doesn't understand what we're telling them, why are they going to want it? Let alone how much it might cost. So, yeah, we have to make sure that we're articulating it in a way and showing it in a way that they can really understand and keep it an easy conversation. I mean, I don't know. Sometimes when we get into too much dental vocabulary, it's overwhelming for people. And nobody wants to say, well, Brittany, go back and what was that word that you used? Periodontium? What exactly is that now? They're just going to be like, oh my God, for me, after I looked back and reflected on my life, I thought about all the bobblehead patients that would just nod at me. And I was like, yeah, they're totally understanding everything that I'm saying. And now I look back and I'm like, they were probably just thinking, is she ever going to stop talking?
Yeah, I try to leave. I can sometimes feel myself getting a little ahead. I try to remember just take a breath and pause, ask them if they have any questions. And whenever you go to do your treatment plan, you can tell them when I'm back, I'll answer any more questions that you think of. And there are some patients that, even when they see their slide, kind of seem indifferent, even though they know what they're looking at. And my solution for that is, even though as a practitioner you should be objective, I do think it's good to respond with your own emotion to their slides. Because if this person, this lady that cleans their teeth twice a year cares that much, then that means they should too.
Yeah. Yeah.
So I'm like, that looks amazing, or there's more here than I want to see. And I always just have some sort of tell that I know they can see. It kind of brings the conversation more to life. Because if you're kind of deadpan and super narrow and straight faced about it, then I think they kind of mirror that because they're in your territory. So they're following your lead.
Yeah, absolutely. And people process information different. I mean, I know I've had some patients that just look at it and then I ask them what questions they have and they're like, I don't know. Can I share with you what I'm seeing? And
Yeah.
other people are like, oh my gosh, get it out right now. That's disgusting. Okay. Yes. Let's talk about what we need to do. It's like, let's have a back and forth conversation about these new findings today. Well, Brittany, is there anything else that you would like to share with our audience here about the program, about just words of advice or just anything at all?
After you start implementing everything and you've been doing it, it's been about a year for our office. When you start to see those follow-ups, that is when you know that this was the right move. There are people that have gorgeous slides that I never would have thought would heed my advice. But, and there's also people that don't do super well, and you have to remember that you did your job and you did what you were supposed to do. And you have to remind them that the ball's in their court. You're passing the torch on to them. It's on them. Whatever we do there, that's like, I always tell them, if I do this for you and you go home and don't change anything, that's like taking one antibiotic and not finishing the rest. It's not going to do anything for you. So ball's in your court, buddy. You got to hold these people accountable. It's just the way it goes. But I feel really good about it every time I see a good slide. And even when I don't see a great slide, but there's progress, I tell them nobody recovers fully from surgery in 6 weeks. So just keep trying, keep using the water pick, hydrogen peroxide. Like, we'll check again next time. I know you got this. I mean, the positive reinforcement goes a long way.
It does.
Nobody's going to want to go home and water pick after being lectured. So
100%. I so agree with all of that. I mean, it's nice for people to be able to see their infection so that they can do with it what they want. Like it's their body, it's their choice. We're their coach. We're going to coach them up as much as we can. Progress over perfection is so true because some people, like everyone's immune system is different. Medical histories are different. Some people just take longer to recover. But my gosh, it's so much nicer than us poking around with a probe. I mean, like, I think it's better. There's less bleeding.
yeah.
Does that mean it's better? It's a very nice objective tool. Amazing. Well, Brittany, thank you so very much for your time. Thank you so much for being such a dedicated, amazing dental hygienist. Your patients are so lucky to have you. The new hygienist at the practice is also extremely lucky to have you, as well as doctor. So thank you so much for being here. And until next time, friends.
Thank you.
Thank you for listening to Mouthy Matters. If this episode helped, I'd love it if you shared it with a friend or left me a quick review. It really helps the show grow. And if you want a simple next step, download my 6-minute guide. It's in the show notes. We'll see you next time.